Hello everyone. Today we are talking CCS, a very important section of USMLE Step 3 exam, and for some students the most difficult one. We will show you how to work on CCS software and how to solve CCS cases in general. This video is presented by Mapping CCS, a unique program for CCS with 113 cases in an interactive PDF format. With Mapping CCS, you will have the comfort to solve the most difficult cases in the exam. As a compliment, we offer you a 10% off coupon at the end of this video. You can use it when you purchase mapping from our website. So, how to work with CCS? Let's start a case. The first screen will look like this. Here you can see the time allotted to the case. In this case, it is 20 minutes. In CCS, you have long cases, 20 minutes long, and short cases, 10 minutes only. Now, the next thing for you to do is to click on the Start Case button here. Okay, so we click there. It takes few seconds for the program to load the case. Then the case will open. Now, the goal in CCS is to test your clinical management skills. So they offer you a patient chart and they ask you to manage the case. Patient chart comes in 3 consecutive screens. The first one is the case introduction. Here you can find the chief complaints of the patient, why the patient is in the ER, why he came to the clinic. Okay, so we read. After reading, we click OK. The next screen is about the initial vital signs. Here, you can determine whether the patient is hemodynamically stable or not. We read, finish, and then click OK. The following screen is the initial history screen. Here, you will have the detailed information about the current illness, associated signs and symptoms, past medical and surgical history. Read carefully. Here you have very important information that hold the key to management and can determine which management approach to take. Click OK when you're done. Okay. Now you finish with the patient's chart. The software will offer you the opportunity for management, and that is done through 4 buttons here on the toolbar: the physical exam button, writing order, clock, and location buttons. Now, before you start management, you need to ask yourself the following questions. Where is the patient now? Does the patient need immediate treatment or intervention? Where the patient now? We can use this icon to determine the location, and the patient is currently in the office. Does the patient need immediate treatment or intervention? I'm not solving this case in particular, so let's assume that there is no urgency in the case, and there is no need for emergency intervention now. So the next step is to click on the physical exam icon from the toolbar. Physical exam consists of 12 components. You can choose all of them if you are doing complete physical exam, or you can choose some of them if you are doing targeted physical exam. So I'm gonna choose complete physical exam. I will check all systems here. Okay, now when you're done, click OK. Now you need to confirm your order of complete physical exam, which takes 15 minutes for the software from the software time. Okay, so we click OK, we confirm. Now the software will be automatically advanced 15 minutes, and it will offer you the physical exam report. Quickly scan through the report, identify the abnormality in the physical exam, any abnormal findings, and take notes. Now click OK when you're done. Okay, now you have the patient's chart, you have the physical exam report. Now you need to combine the information you already have from the history with the physical exam findings and use it to draw differential diagnosis for the case. Now, you need to confirm diagnosis by ordering diagnostic tests, and we use the Write Orders button to do that. So I'm gonna click Write Order button. Okay. Now here, when you click Write Order button, you will have the order sheet page. From there, at the bottom, you can click on the order. Okay, and here you can type your orders. You may write a test, a procedure, diagnostic or therapeutic orders, etc. So I'm gonna write some orders. You can write a procedure, you can write imaging studies. I will write imaging study. Okay, when you finish typing, you need to confirm your order. Okay, so confirm order. That will bring the order verification screen. You need to confirm that what you type is what the software understands. So the CBC that you type is really the CBC with differential. So you confirm that this is the order. Then we will have the urgency and the frequency options here. You can change the frequency. Okay, so we click OK. Now we have to do this for each item we requested for all orders. Okay, for the BMB, UA, okay, I confirm. Okay, so I typed ANA, and the computer will offer you a list of items that match what you typed. So from the list, I choose the one that I meant to order, which is ANA serum here. So I double click there and confirm that this is the order that I want. Okay. Another test. Okay. Now, when you're done with your orders, the order sheet will look like this one here. It has all the orders, a list of orders. You can have the order time here and the report time here. Now, in order to confirm diagnosis, we need to see the results of our diagnostic test. Now, the software will allow you to advance the clock using the third button from the toolbar here. So let's advance the clock to look at some results. Okay, so I double click here. Okay, now the re-evaluation. Okay, so we can advance the clock using the re-evaluate case on in with the next available results. Call see me as needed. Now on the software will be advanced to a specific hour. For example, here we can let's now the current time is 11:15 a.m. Now let's make the follow-up in at 11:45. So I will change it to 11:45 and then confirm. Okay, we can do it another way by choosing N. N refers to the duration of time. I want to see the patients in 15 minutes duration. So after 15 minutes, I will see the patients. So you can type here in 15 or 30 minutes. I will type 30 minutes. Okay. You can also choose with the next available results or call me as needed. So I will stay within 30 minutes. So I will see the patient in 30 minutes. I will check with him and look at some of his results. Okay. So now in 30 minutes, some results will come out. Okay. So I need to review these results. Okay. Take notes about any abnormalities there. Okay. Now, at the end of 30 minutes, we still have some diagnostic tests left, and they take long time. They take days to come out. So here you have to determine what to do with the patient. Should I keep the patient here? Should I send him to the ICU? Should I send him home? Okay. And in order to do that, you can choose the fourth button from the toolbar. So I'm going to click there. I will send this patient home. Now, when you click there, the program will offer you 5 different locations: the emergency department, the office, the ICU, home, inpatient units. I will choose home. Okay. And I confirm the change location. Okay. So now, when you send the patient home, you need to schedule appointment for his next visit. Okay. So I want this patient to come back when all the results, diagnostic orders results, come out. So that will be in on day 3. So I will schedule his appointment by that time. So I will choose day 3 from the calendar. Okay. And I will change this one to 12:45 p.m. and I confirm. Okay, so I need to confirm the appointment. Okay, and then I confirm the move. Okay, now the patient will go home. Okay, and the result start coming out. So one by one. Okay, so review the results. Okay, and at the end, when the diagnosis is confirmed, you need to offer treatment to the patient. Okay, so now the patient arrived for appointment. Now the patient is in the clinic. We review his vital signs, his current vital signs. We may do a follow-up on the patient to see if there is any updates on his status. We may repeat physical exam on all systems or on specific systems. Okay. So I click OK, confirm. Okay. Now next, I will write orders, treatment orders. We have diagnosis confirmed, so I will write the treatment. Okay. So we go to the write orders. Okay. And we can write the orders from here. Okay, using this button. Now, let's say that I want to see the patient's chart. I forget about something. I want to review something. How can I pull the patient's chart? I can do that from the order sheet, from this page, from writing order button. Okay, so here you have all the information about the patient. Okay, so if we click at the progress note here, you will have information about the initial introduction, the chief complaint. You have information about the detailed information about the patient, the current illness, physical exam report. All the information are saved and stored here. you can have all the information about his vital signs, lab results that we already have. So if we click on any one of them, we will have the results. Okay, if there is any imaging studies, you can have the results from here. Okay, so for this patient, I'm gonna write treatment orders. I already know the diagnosis, so I'm gonna go ahead and write orders. So I click on the write order button. Okay, so with the write order button, let me type some orders. You can also give advice to the patient. You may ask for consultation. Okay, when you finish, confirm the orders. Okay, just like what we did the first time, one by one. Okay, so we confirm this order and move on to the next one. Okay, the program will offer you a list of items. You need to confirm which one you want. Okay, we confirm. Okay, now consultation. Which specialist you want to consult with? Okay, so I will choose, for example, consult rheumatology. So I choose rheumatology and confirm. And now I have to write the reason why I'm doing this consultation. Let's say for joint pain. Okay, so you give explanation why you are giving, why do you want the consultation. I click OK. Okay, now for medications, we are counseling the patient about the side effects of the medication. I confirm. I click OK. Okay, so we have the orders in our order sheet. Now the next thing to do is to send the patient home and then do follow-up on the patient. Now in CCS, it is not enough to offer treatment to the patients. You need to monitor the results on the patients. You need to see whether your patients really working on the patient, whether the patient, the condition is improving or not. So I'm gonna send the patient and I request another appointment. Okay, I will schedule the patient for appointment, and the next appointment, let's say I want the patient to come in on 3 or 4 weeks. Okay, so I'll schedule him for a new appointment and I will send him home. Okay, now the result start to come out and we will have some updates from the patients. Okay, okay, so we have patients updates. Now the patient problem is less severe, and that is very positive. That is an encouraging update. Okay, so click OK. Now when you read the positive update like this one, you should feel good about your management and that you are on the right track. So click continue. Okay, keep advancing the clock. Now when the software determined that you achieved the required management steps, the case will end and you will have the last 2 minutes screen. Here you can finalize your order. You can do you can type new orders. You can do screening tests, vaccination orders that are appropriate for the case. So I'm gonna click OK. Okay, so let's say that you want to give advice for stop smoking to the patients, do pap smear, or do mammography, colon cancer screening, etc. So let's type patient consult. Okay, we click OK, confirm the orders. Okay. We cancel the patient. Okay. We stop smoking. Stop smoking. Okay. Pap smear, etc. So whatever you find appropriate for the case, you need to order. Okay. Stop smoking. Okay. And now when you finish, you click on exit case and you write the diagnosis. And you're done. Okay. Thank you for watching. I wish you good luck in your exam.